founder of the Youth Advocates for Global Health Association.
And my name is Matthew Yu. I'm the vice president of the organization.
Youth Advocates for Global Health Association is a nonprofit organization led by students passionate about the medical field. The association serves as a bridge connecting aspiring healthcare professionals with established experts in global health. The topic of today's webinar is oral health and its impact on overall health. We are honored to welcome Dr. Thomas Yu as our distinguished guest speaker for this event.
Dr. Yu's educational journey is a testament to his dedication and expertise in the field of dentistry. He earned his Doctor of Dental Medicine from the University of Saskatchewan, followed by a master's degree in periodontics from the University of Toronto. His extensive training includes 3 years in microbiology at the University of Saskatchewan, a 5-year dentistry program to obtain his DMD, a 1-year residency at Mount Sinai Hospital in Toronto, and 3 years of graduate studies in periodontics. He is currently running a busy private practice in Calgary. And in addition to his expertise in periodontics, he is one of the most renowned amateur pianists in the world, having performed with the BBC Orchestra of Wales, Toronto Symphony Orchestra, and Cape Town Philharmonic Orchestra, just to name a few. He's also won countless awards, being the unanimous winner of the prestigious Cleveland International Amateur Piano Competition in 2016.
We are ecstatic to have Dr. Yu share his insights with us today. Following the presentation, we will have a Q&A period where all webinar participants may submit their questions using the chat function.
So yeah, let's give a warm welcome to Dr. Yu. Thank you so much for joining us today.
Well, thank you, Matthew. Thank you, Jonathan. It's a real pleasure to be a part of this meeting, and thank you for the invitation. I'm pretty impressed with how much you know about my education background. Very well researched. You do your good work. I will just get started into things here. So let me just share my screen here and I'll get this going. So once again, you guys can see this, okay?
Yep, we can see it. All good.
Okay. So yeah, my presentation will run maybe about 15 minutes or so, and then I'm happy to answer any questions you may have about my specialty of work or my life outside of work or how I got here. As you guys have mentioned, I am a periodontist, which is one of the subspecialties of dentistry, focusing mostly on the foundation of the mouth. So this is the gums, the bone. If I tell patients, if you're building a house, I'm the foundation person. It's very important to have a good foundation before you can do anything else. So we want to talk about periodontal disease and how that affects the foundation, not only in the mouth, but also how it relates to overall health and how you manage this. So you're going to get a perio degree in 15 minutes here. As mentioned, I did my dental training in Saskatoon at the University of Saskatchewan, where I was also born and raised. I then moved to Toronto to do my postgraduate studies. In Toronto, I focused my first year at a hospital residency at Mount Sinai Hospital, which was very grueling, but also very rewarding. Lots of broken jaws and really dramatic infections, ICU work, and things like that. Beside Mount Sinai is Princess Margaret Hospital. That's where I did my master's degree on head and neck cancer. And yes, I do have another life in outside of work. I'm an amateur concert pianist. So if you ever want to follow me on social media, I do put a lot of music stuff on my Instagram. And I just very recently posted a new video of a concerto that I performed in Taiwan. This is a picture of that. And so you can head over to YouTube and see the full performance. So it is this between all these things, it keeps me along with raising a couple of boys. It keeps a very, very busy schedule. So periodontal disease, what do we think and how do we define it? Back in the day, they used to think of it more as an infection, when bacteria found in plaque would cause bone loss and ultimately cause you to lose your teeth. Well, that's changed now. The idea of it now is more of an inflammation, an inflammatory response to plaque biofilm, which causes bone loss. Then and that contributes to the poor overall health. Well, let me just see if I can get this here. So this is an interesting sort of diagram. Without good periodontal health, you can't have good general health. They are very related. I mean, if you look at our body from a primitive standpoint, we start as a digestive tract, and the start of this tract is the mouth. So it is kind of the entry point for a lot of things, and therefore there is a lot of correlation to other systemic issues. If you have bacteria in your mouth and you aspirate it, that can go into your lungs and cause a respiratory infection, as well as osteopenia, which is kind of the precursor to osteoporosis. We find a reduction in bone mass associated with gum disease and periodontal disease. And women who have advanced gum disease may be more likely to give birth to a preterm or low weight baby. And this is why when people are pregnant, we encourage them to maintain an optimal oral health, not only for their own well-being, but their fetus. On the right side of this diagram, you can see a lot more of the serious and probably more common things that we'll see relating to periodontal disease, and that is cardiovascular disease. You have an increased risk of stroke and heart attack. This is something that I've seen firsthand at work. Patients who had a heart attack, and there's got to be no other risk factors except for having periodontal disease. Sometimes there are secondary risk factors as well. Like if somebody has heart disease, they may also be like a chronic smoker, chronic drinker. And this all contributes to the relationship to periodontal disease as well. Also, if patients have uncontrolled diabetes, or they find that it's very difficult for them to control their blood sugars, they should check their mouths, because there's oftentimes a correlation, a very direct correlation to periodontal disease. They are 3 times more likely to develop it than non-diabetics. So inflammation is basically kind of the basic concept of a lot of diseases in all our bodies. But inflammation is a good thing. When you're playing basketball and you sprain your ankle, and the next day you have a big swollen ankle, that's a good inflammation. That's your body trying to repair tissue injury, bringing in all the good cells to repair yourself. So purpose is actually to protect the body from damage. But when the inflammation becomes chronic, this causes tissue destruction. And this is the inflammation that you can see in some of the diseases that we spoke of. Also, Alzheimer's disease, asthma, Crohn's, eczema, gastroesophageal reflux, lupus, cancer, obesity. I mean, inflammation is everywhere. And so that is a very hot topic as far as how this all links together. When you look at chronic inflammation, there's different cell mediators, things like inflammatory cytokines. There are markers that you can test for where you'll find higher levels of certain interleukins and C-reactive proteins in people with heart disease or periodontal disease. And this is what research is taking us to, is to find the commonalities. So to summarize, what is periodontal disease? It's a bacterially induced chronic inflammatory disease that affects the soft and hard tissues which support the teeth. Nowadays, a very common issue I have to deal with now is this bacterially induced chronic inflammatory disease affecting the support of implants, dental implants. And that is a new term called periimplantitis, the loss of bone around and gum around implants. It becomes very common and much less researched. At the earliest stage of inflammation in the mouth, it is gingivitis. That is reversible and much easier to treat. As you can see from this picture, advanced periodontitis, by the time patients are referred to me and their bone loss and gum loss is so severe that it's almost at the end of the tooth, well, there's not very much more we can do. Oftentimes these teeth are loose and ready, the body wants to remove the teeth themselves. So how do we treat these things? Well, so many times patients will come to me, and as soon as they sit down, they want to start talking about what treatment they want. Oh, I want this. Oh, I don't want my teeth removed. I want to hang on to my teeth as long as possible. Oh, I want you to take them all out and get implants. Well, we can't talk about that yet. Like all disciplines of medicine, in order to properly come up with a treatment, you need to start with a proper evaluation. And I would say that even when those patients sit down and start talking about treatment, I'm already processing that as part of my perio evaluation. Okay, this person really wants to keep their tooth. Let's go with all those options, because there's never one way to treat a patient. So you gather all this information and come up with a diagnosis. And from the diagnosis, you come up with a treatment plan. How are you going to manage this, make it better, not make it better? What are the risks and benefits of these treatment plans? From there, usually in periodontal disease, we'll start with initial therapy. That is getting rid of the bacteria and reducing the inflammation in the body. And then we reevaluate how that went. After reevaluation, we can then see how to maintain these patients. How are we going to prevent the recurrence of these diseases? And missing from this chart would be surgery. There's another modality of treatment that we would want to consider. So in a periodontal exam, we start with the extraoral examination, the face. We look for swellings, lymph nodes, check the jaw joint, see how that moves. We'll understand if this patient is clenching, grinding. I know I certainly was when I was in university, and that can play to the effects of your foundation, your gums, and your bone. Intraorally, we're looking at the gingiva. What does it look like? How does it feel? I mean, even pressing on the gums, you can get an idea of how this patient is doing before you go into the nitty gritty. Probably the most gold standard of measuring periodontal disease is to measure the probing depth, or the pocket, which is that space under the gum. This gives you an idea of how far bacteria has progressed in. So if your probe goes in 3 millimeters, your patient's still fairly healthy. When it goes to 5, things might be still okay, but starting to turn. When that probe hits 10 millimeters, now this is definitely periodontal disease, and we need to start to treat it. Not just by the number, we're looking also whether or not this gum is bleeding, whether or not there's pus, and this gives us all indications of how somebody is doing. I often tell my patients that we're not just I'm going to get all these numbers on the page, but we're not all just numbers on a page. And that would be, one advice to all of you who pursue a field of medicine. Oftentimes you're going to be given a set of records, whether it's lab records, clinical finding, measurements, and you're going to have a whole set of numbers to process. Well, we're not just the number. Where is this number? Where did it come from? Where is it going? How does it relate to the whole body as far as how the balance should be? This is how we process periodontal disease. You also need to look at these perio-systemic interrelationships, some of those diseases that we talked about, whether or not the patient is a smoker, whether or not they have good oral hygiene, and this is going to determine how serious this periodontal disease is. There are other things that you have to look at when you're diagnosing and examining a patient. From the dental side, well, you're obviously looking for cavities, caries. Are there any gaps between teeth where food and bacteria are going to get trapped into? Are there any types of fillings, crowns, bridges where bacteria is stuck underneath? And implants, where are the implants? How are they placed? Are there any traps where bacteria can affect the implant? One of the most important things I'll look at is the bite, the occlusal examination, basically looking at how the teeth sit together, whether or not people are clenching, whether or not the teeth are hitting heavily on a certain site more than others. Maybe everybody's hitting on their front teeth and not using their back teeth. Maybe they don't have back teeth, and that's why they do it. How How are the implants in the mouth and how are they sitting? They're supposed to sit and hit differently than natural teeth. And occlusal trauma. When they bite down, are there any teeth moving and shifting? And finally, we look at radiographs. So we're looking at bone levels in this, and also looking at whether or not we can see the bacteria. If you look on this picture, there's little calculus deposits on the root of these teeth. If it shows up on an X-ray, it's definitely advanced. So this would be a typical digital charting that I will do for a new patient, get all the numbers on the page. And as I said, it's not just about numbers. You can see on the chart here, some red dots, yellow dots. These are areas that might be bleeding, might have pus. We look at these green arrows, black arrows. This tells me if the number has gotten better, gotten worse, right? Sometimes the patient will say, oh, I have a 7. You said 7, that's so bad. And I'll say, well, it was a 9. So that's actually a lot better. The chart on the right is something that I'm thinking about while I'm examining and not necessarily shouting out unless it's significant. Like I might see that the gums are edematous or swollen. The gums may be receding. And of course, there might be this bleeding that we notice. So you do that all in basically, like, as you know, at this stage of my career, I can do that in about 5 minutes. But at the beginning, this is a step by step, not to miss any beat. And because all of a sudden through these informations, this is how you decide what you're going to do. We talked a little bit about periodontal risk factors. This can be categorized into modifiable risk factors or non-modifiable. Modifiable, like things like smoking, oral hygiene is really big, diabetic control, type of medications, whether or not they're clenching and grinding. Stress. There is a definite correlation between stress, coping mechanisms of stress, and periodontal disease. Even just something as simple and logical as people under stress don't take care of their mouths as well. Maybe they don't have the time, maybe they don't have the motivation to do it. But there's also inflammatory issues as well. Non-modifiable, whether or not they've had periodontal disease in the past, what their age is, gender, race, genetics. Genetics can play a role up to 50% of the time, and sometimes we'll test for that. But there's very little we do on the or can do, obviously, on the non-modifiable factors. So how do we treat once we decide? Well, initial therapy usually means like a deep cleaning. So all those bacterial deposits under the gum, the first thing we want to do is clean that off and establish kind of the best state a patient can be in. So that can be teaching them how to take care of their mouths, talking to them about smoking, giving them fluoride antimicrobial therapy, correcting their bite. But the bread and butter is root planing. Root planing is basically a cleaning that's under the gums, and all those deposits, they're stuck on the root, and they're under the gums. It's something that you can't see in the mouth. It's actually probably one of the most difficult skill sets in dentistry, the ability to clean the root, simply because it's the only way you can learn how to do this is by experience. So root planing is the definitive procedure for the removal of cementum and dentin that is, populated by calculus or contaminated with toxins. So to root plane, we use different instrumentation, scaling with scalers. This removes the plaque and tartar from below the gum line, and then this root planing, which basically then smooths the root to basically create a slipperier surface so that bacteria can't stay in. Below there, that's an ultrasonic machine where we use ultrasonic irrigation and vibration to get rid of this bacteria as well. We won't bore you with this chart, but basically there are other things you can do besides scaling and root planing, but nothing is better than scaling and root planing. So if you're, not to go off topic, but if your dental clinic is advertising, we do this, we do that, we do antimicrobials, we do laser therapy, all these things, you really just need to find a good hygienist that is going to keep your mouth clean and keep your teeth in health. Sometimes we'll use adjunctive therapies like local antibiotics, systemic antibiotics. Generally, that is when we are not getting the response that we want with the regular cleaning. And I mentioned quickly lasers. It's just not proven, not enough research and not enough good research out there to say that that is something that's going to really work any better than just good old-fashioned cleaning. So I'll finish up then with sort of the things that we'll do as periodontists besides deep cleanings. These root planings are done with my hygienist typically, and then I will reevaluate this patient 6 weeks later to see how much better they've gotten, and then we decide on their maintenance or decide to move to surgery. So surgery is when we need access to clean these roots, because I said you have to do this all blind, and sometimes it's impossible. So we have to go in surgically to clean off all this bacteria and therefore reduce those pockets. We can do this in a couple of different ways. We can recontour the bone, recontour the gum, or we can regenerate the bone and regenerate the gum. Sometimes as far as improving that support. This is done by bone grafting or bone stimulating materials, gum grafting as well, which improves the appearance of the periodontium, and then basically enhance prosthetic dental care and allow placement of dental implants. I would say that dental implants probably comprises like 90% of my practice nowadays. The other 10% of my cases, well, gum surgery is indicated. Sometimes we do this not for periodontal disease, we'll do it for cosmetic reasons. Patient could come by and tell me that they have a gummy smile. They show a lot of gum and they feel like their teeth are too short, when in fact it's just that their gums are overgrown. Crown lengthening can be a nice cosmetic option for them. Very common in my practice as well would be gum recession. This is when the support of the gum is missing either due to periodontal disease or other factors like orthodontics. We have to restore some of this gum that's been missing. That can be done for cosmetic reasons, but also for functional reasons to regain that support structure, regain the foundation, and prevent future recession. And finally, like I said, dental implants, that's my day is based on tenths of a millimeter, finding the right space and putting a titanium post in to replace a missing tooth, and rebuilding the bone and rebuilding the gum structure. Oftentimes, these people have lost their teeth to periodontal disease. So a lot of them have gone through that first phase process where we get their periodontal disease under control and then start to replace with implants. So that's pretty much what I do on a daily basis at work. And then after that, I get home and say hello to my kids and have dinner and play with them. And then once they go to bed, I start practicing piano. So this season is quite busy coming up. Next show in Calgary will be in the spring, so I've got to get ready for that already right now. So that is the end of my show. Let me see if I can stop the sharing here.
Yeah, that's very exciting. We will get to your, we will discuss your life as a pianist later on in this webinar. But before we get to that, I have to say I found what you mentioned about periodontal disease to be very educational. And I found your explanation of its causes and effects on overall health very informative. So could you please clarify how lifestyle choices like diet and smoking impact gum disease?
Well, if you, excuse me, if you smoke, can you see my face, by the way? Is it okay? We're back on not sharing. Okay. If you smoke, you're 4 times likely to lose a tooth. And so sometimes that is smoking cessation is something that we'll spend time talking about. It's very difficult to stop a habit of smoking. Um, the You have to approach it from different angles, and sometimes just telling people that about their tooth loss is enough. I mean, you can tell them that they'll get a heart attack or lung cancer and they still won't stop smoking, but as soon as they lose a tooth, they realize this is serious stuff. So it's because it's probably more visible and more something that they can comprehend. So lifestyle factors are very important as far as discussion of things. Somebody smokes, we can't even replace these teeth with implants. It's another motivating factor for somebody. When you start telling them how much an implant costs and what happens if that fails, then that's a financial motivator for them. So we try to encourage them in any way possible to limit their smoking at least to less than half a pack a day.
Yeah, I didn't realize that poor gum health can lead to so many health complications, right? Like heart disease, stroke, all of the things you mentioned. I was just wondering, so like how common is gum disease? Kind of like, do a lot of people have it? Kind of, is there a rough percentage of the population that has it?
I think it, I think it's about 25%. It's actually quite a large amount. But it's also because there's a different amount of degrees of periodontal disease. I mean, there's mild, moderate, and severe. I mean, you can get much more specific in the diagnostic categories, but it's more prevalent than not. It's one of those things where it's painless. I mean, it's something that a lot of patients have no idea. So, there are some diseases in our bodies where we know something's wrong, like I have an infected finger. And then there's other diseases that we don't know what's going on. I have something, it's that there are silent diseases, silent killers. Periodontal disease is one of them. I would say that pretty much everybody that comes in for that has periodontal disease in my office have no idea really what's going on. And a lot of times they say nothing is wrong and nothing's in pain. Well, we can't use pain as our guide. So it's more common than we know, and there's a lot of people probably that have it that don't know it.
Mm. Right. Do you think more education will help people to understand kind of what gum disease is and kind of how to prevent it? Because I feel like we don't have enough discussion about this topic right now, maybe in schools or just as a public health aspect. And I think it would really benefit if more people kind of knew about it. Like, what are your thoughts about that?
Oh, I'm all for education. We've in the province of Alberta have started an ad campaign, not for anybody's benefit, personal benefit, but as a periodontal society as a whole, putting in adverts in and social media and also like in those WestJet magazines and things like that. So we're hoping someday somebody thumbs through one of those and reads. But education is important for anything. I mean, that's if we were educated on everything, we would be a lot better shape than we are now.
Definitely, I totally agree. So, what are some of the latest advancements in dental implant technology that you really are expecting, like with the evolution of AI and such?
AI at this point, what I think it helps in dentistry would helps more in the diagnostic categories, helping you in the diagnosis, gathering the information and helping you process, which actually is probably one of the hardest things to do as a clinician. Is you have, like I said, some of these things you have to learn by experience, and AI, I think in the future, if not present, can help a lot with interpretation of X-rays, gathering all the numbers, the history, and coming up with some type of guidance on diagnosis. In treatment, I've seen a robot place an implant in China, but I think that's still a ways away to becoming the mainstream. So, oh, I would say also one of the things that new technology would be now, as far as implants go, would be yeah, computer guided computer guided treatment plans, computer guided implant therapy. So I was showing you that the placement of an implant is so finite. Nowadays, you can plan this all using a computer to guide you eventually, so that you don't have to be so skilled in the hand-eye coordination and more just being able to program things into the software.
That's cool. We're always interested about new technology in the field of dentistry or medicine, so it's nice to hear your thoughts about that. I was just also wondering, like, I guess, how can patients more effectively maintain their oral health between the dental visits, just like us everyday people as well? I know we mentioned those negative behaviors that can contribute to having gum disease, but I was also wondering if you have any tips to maybe taking care of our gums and teeth better on an everyday basis.
Usually, what I tell people is that in order to keep a healthy periodontal health, you've got to look at the two killer bees. That's the bacteria and the bite. So on a home standpoint, the bacteria control, well, I'm a big fan of electric brushes. Electric brush, floss. I do like water picks as well. I think these are great tools to have at home to keep your mouth healthy. I don't believe in fancy mouthwashes and anything else in terms of what's out there, but an electric brush, like a $30 electric brush, is all you need. That's what I use at home, and a piece of string will probably put me out of a business at least half the time. As far as the bite, I always tell people to look out, whether or not you're a clencher or a grinder. Oftentimes during exam periods, or even during exercise, or sometimes at night, we clench our teeth. And so I tell people, if two teeth are touching, you could be a clencher. So if a bottom tooth is touching the top tooth, you could be a clencher. Normally, we shouldn't be touching our teeth when we're at rest. So if you are, then talk to your dentist about a night guard and something that you can wear at night. Again, I've been using mine for longer than you've been alive, probably. And I do believe in using that because it saves. I've seen enough harm from what a heavy bite can do to somebody.
Yeah, that's interesting to hear. Kind of adding on to Matthew's question, what would you say, like, what role would nutrition play in maintaining good oral hygiene?
Well, I think that's we go back to that idea that we are just primitively a digestive tract, and so if we put in all these processed foods and sugary foods, then this is going to affect our oral health. Now, in university, I wouldn't have survived studying for my exams without candy. I needed I needed a pack of candy or granola bar or something to keep me going, to keep that glucose working my brain, but feeding my brain. But I would say that if you have a sugary snack at this stage, to always make sure that you rinse it off with some water, or sometimes what I'll do is chew some gum for 5 minutes to get the saliva flow to wash my mouth, basically wash my mouth if I can't just go and brush my teeth. So yeah, there's and as far as nutrition goes, anything that's healthy for the body is generally healthy for the teeth, right? Um, Lots of vegetables and things that don't have a lot of sugar that's going to stay in your mouth is generally good. And you got to watch the soft drinks as well.
Yeah, I mean, when you talked about like rinsing your mouth after every sugary kind of treat, I really resonate with that because, well, when I was younger, my grandpa would always tell me, like he would monitor me every time I would take a piece of candy. He's like, you better drink some water, make sure you rinse it for at least 10 seconds. And I would always do that, and I would go to the dentist, and all my teeth would be perfect. And then recently, I kind of stopped doing that because I got complacent, and I thought I could beat the system of health. And I recently went to the dentist, and don't tell anyone, but I had quite a few cavities, and the gums weren't looking very good. So I think I will continue to take those tips. That's a very good reminder. I did just want to ask about kind of the gum recession aspect because I did notice I do have some friends who are asking me about that, but also me, I realize some of my gums are receding. So I don't know if that's an issue or like, could you just talk a bit more about that?
Yeah, gum recession is extremely common. Everybody has gum recession. I'll never meet somebody over the age of 50 that doesn't have recession. So recession can be caused by, generally three main things. So heavy brushing. So one of the things is that if your toothbrush starts to look frayed as time goes on, you're probably brushing a little too hard. Again, this is why I like an electric brush because it just kind of does the job for you. You just sort of, you're forced to be more gentle. The second is orthodontics. Now, that one is unmodifiable because oftentimes people have to get braces or Invisalign, not only as a child, but also as an adult. And we see that the movement of the teeth that stretches will stretch the gum and stretch the bone and ultimately thin things out in some areas, and you'll see that gum shrinks. So a lot of the times, if somebody in your age category says they have receding gums, you follow up with, did you have braces? Because that is something that is very common with that. The last is clenching, going back to that clenching and grinding. That excessive pressure causes a strange wear pattern on your gums and bones. So it's common. The other second thing I would like to say about recession is not every recession needs to be treated. If you can just stop it and prevent it with soft electric toothbrushes, night guards, and no more orthodontics, if hopefully, then you don't need to necessarily visit the periodontist to treat.
Going back to the topic of dental implants. So, in terms of, let's say, technology, would you say 3D imaging has like any potential benefits for accuracy and precision when doing dental implants?
Yes, absolutely. I mean, I don't think that many dental schools or periodontal schools will even teach a non-guided implant technique anymore. A lot of it is all done with CT scanning and computer-driven planning. Not only does it have the potential to be more accurate than the human eye and human hand, um, can be in theory more practical as well. Something that you can plan through the computer, send to a lab to create a surgical guide to allow you to place this implant in. So usually what they do is you plan it all on a computer and then you get a little mouthpiece and then you put this mouthpiece into the patient that has a little hole and it sort of tells you where to put this implant in. So it kind of helps you plan as well as place. So it's certainly for somebody not as experienced in implants, I think that would be a great skill set to have because it gets you up into a level of skill that much quicker than it would with just what I've done, which is just really just hand-eye coordination and experience. That's how I learned my skill. So when you get to my level, then you don't need those computers. Maybe you could argue, but that it would be helpful. But to most skilled surgeons, we don't need the technology. I like to think that that technology is there to help people get to my level as far as to do what I do without having to do what I do, which is stressful and high pressure stakes when you're doing something for the very first time with no other guide but your eyes and your hands. So
Yeah, I think we did have a question come in. How does aging affect periodontal conditions, and what preventative measures can older adults take?
sorry, what was the question? How does aging affect?
Yeah, the periodontal conditions.
Well, you usually don't see periodontal disease until after the age of 35. So it is generally, for the most part, an adult onset uh, disease. Although there are some juvenile periodontal conditions, most of these are age related. I wouldn't say that being older makes you have periodontal disease. It's just more common to find as you are older. Um, Age is one of those non-modifiable risk factors. It's something that we just accept that it does play a role in periodontal disease, only for the fact that somebody who's older has spent more time developing bacteria and inflammation in their mouths. And so oftentimes their periodontal disease is more advanced than somebody who is younger. But it is just one sort of factor in combination with all the others that we talked about: oral hygiene, smoking, and systemic diseases.
Yeah,
Yeah.
it's very fascinating to learn about oral health and how it affects the whole body in general. Now we would like to move on to the most exciting part of today's webinar about your life as both a dental specialist and a concert pianist. So our first question for you today regarding this topic is, how has piano influenced your approach to dentistry and patient care?
Um, has piano? That's a really good question. Um, well, hand-eye coordination is big. I think that helped me a lot in terms of like the surgical skill set, being able to have control of my hands is what makes dentistry or periodontal surgery come more easily to me. Um, the focus, I mean, music teaches you about focus and discipline and just being able to perform under pressure. So that has helped me as far as being a periodontist. There's other factors too. I mean, just the reputation of being a musician sort of helps bring a different vibe, I guess, of patient perio interaction with me, because a lot of times patients are interested in my music life, and so it really is a good icebreaker and kind of keeps things more casual for them, so that it's not so seriously doctor-patient sort of clinical examination. There's a lot of talk about other life.
Yeah, that's really cool. I mean, how do you manage to kind of balance piano and your dental career? How do you manage to like balance your time, I guess, your energy, your effort? Maybe talk a bit about that.
Um, it gets harder as you get older, as far as like being able to manage everything, especially when you have wife and kids and at home and the family to look after and raise. But you never not have time to do the things that you love. And if you love doing something, you'll make time to do it. And in this case, it's playing piano for me. I love, well, I don't love the act of practicing piano, but well, sometimes I do. I love the way it makes me feel as I'm learning something. I love that I'm working towards something. Oftentimes I'm practicing because there's a performance coming up. So, but managing the time, you just have to be very careful. Like you have to have a good system, support structure. Your family, your partners, your loved ones have to all be in, support of you taking this endeavor on, because really oftentimes practicing piano isn't until nighttime, when you'd rather just be kind of chilling out.
Yeah, that's very inspiring. We were just wondering about how, like, very few people out there can be so gifted and very pianistic, but at the same time, we have a career in healthcare. So, how did you decide which one to choose, considering you probably had an interest of both?
Um, I think it just chose me rather than me trying to choose. When I tried to choose, I started to think that maybe I should just go into music altogether. When you're younger, that's probably was the more exciting route for me. And I felt like I had a passion to play music, and I wanted to do that full time. What I didn't understand back then necessarily so easily is that to become a professional musician requires a whole lot more time commitment than I was putting in. And not only that, it required me to give up all my academic life, which was a big part of my life. I mean, even during dental school, I thought about maybe quitting or taking time off to pursue music. I wasn't convinced yet that dentistry was going to be what I wanted to do in my life, or not. It was kind of a very interesting conflict that I would have, not only with myself, but myself and my my teachers, my music teachers, my dental instructors, my parents, like everything, just, I couldn't figure out what I wanted to do. But it wasn't until I met my piano teacher in Toronto who encouraged me to do both, you know. Um, that started to make a lot of sense to me. He told me to finish my dental school and then get to Toronto. While I was doing my residencies in Toronto, in the hospital residencies in Perio, I would have private lessons with him at the conservatory. So that was probably the time where I realized that this is who I am. I'm just going to keep doing both and not have to make a decision. And yeah, it's worked out well.
Yeah, that's really resonating for us because obviously, like Jonathan and I, we both play piano. We're both really interested in a lot of other areas, and so it's good to hear how you can, at the end of the day, do or go down many different paths. You don't have to choose necessarily one, and I think you're setting a really good example. You're a really good role model. Um, I don't know. Do you ever use music in your clinic to help ease patient anxiety?
Yes and no. I know I really don't do that because my joke to them is usually like if you want to hear me playing to calm you down, then it's going to make me nervous, and you don't want me nervous. I'd rather have you nervous than me nervous. Um, I would say that, like I was saying before, I think this discussion of music, a lot of times patients want to know, you know, where I'm performing and asking the same questions you ask, and telling them stories because it's actually, you know, obviously they can't speak very much when I'm doing work in their mouths, but you know, they might hear a story of my last performance or performance coming up or some, you know, story from the past in my music life. So that's like music verbal therapy rather than the actual music itself. Usually I have some sort of background um, TV going on or something that gives me this sort of, when I hear TV, I sort of zone out and I don't even pay attention. When music's going, then I start focusing on that, hyper focusing sometimes.
Yeah,
Just
for sure.
on the topic of like stress and anxiety, I was wondering if you do have any tips to kind of like reduce stress while maybe performing or getting ready for a like concert or a competition or anything like that.
To reduce stress, the first thing is to practice and be prepared. Like there's nothing more stressful than being up on stage and wondering if you're ready or not. You know, if you haven't practiced enough to get there, then that can be pretty hard on the psychological side of things. So for me, I always have to prepare. Like that gives me that motivation to practice because the more I practice, the less nervous I'm going to be, less stressed out I'm going to be. Um, on stage, backstage, I oftentimes do things um, to distract myself. I will do a whole series of stretches. I'll do push-ups, some jumping jacks. I'll go for a little walk down the hall and back. I'll be listening to music, music that's not entirely close to classical music, just whatever gets my head spinning into another space. So I don't think about it. When I was there, when I was younger, I would almost like I would actually have to wait until the beat dropped, and then I would take my headphones off and go on stage. Even when somebody was sort of waving, it's time, it's time. I'm like, 1 second, I think of, okay, here we go. So there's just things that I could do to distract myself on the day of was key.
Yeah, how exciting. You certainly have a lot of notable musical accomplishments, such as playing at Carnegie Hall and winning the Clyburn in 2016, I believe it was. Could you please talk about what it was like and which one was your favorite, like peak of your musical career?
Um, I don't know if I have a peak in my musical career. I would say that playing in these venues, I mean, was kind of like a life dream and something that I never thought would happen, especially choosing a life of medicine. Like I never thought that I would um, then be on the stage. It was interesting that this amateur direction in my life allowed me to go to all these places. the peak of my career, to be honest, still one of the highlights I would say would be the very first time I played with an orchestra. That was a memory that I'll always have. That was with the Regina Symphony when I was 19 or 20. And since then I've been very fortunate to be able to play with so many different orchestras and different halls. But I always look back on that very first moment when all my friends drove down to Regina to hear me play, and we all crashed together in one hotel room. And it's the first experience that never been that excited in my life. So so that was definitely a highlight. It's kind of interesting to mention Regina in addition to like some of these grand concert halls.
Could you kind of tell us how you first got into music and how your interest in dentistry also sparked? We kind of want to understand a bit more of, how you got to the point of doing both and, just kind of your life story there.
Well, the story goes as this: that I was watching my older sisters practice piano when I was 4. And when they would finish, I would hop on the piano and start mimicking and doing what they were doing. So it's kind of funny because I actually saw my youngest son do that once, watching his older brother practice piano. So it was at that time when my parents decided they should put me into piano. I don't even think that they were planning on it, but because I showed that kind of interest, that's how I started. And then I never really enjoyed playing piano until I was about 17. I just kept doing it, partly, parental pressure, but also just I did it because I thought I was good at it, but I never enjoyed it. And it wasn't until I was in high school that I realized that this is actually something that's really, it actually brings joy to other people, which is kind of something that I didn't realize until I was older, that other people like this. And so this is why I want to play. As far as becoming a dentist, no, that was never in my life plans. I thought I would be a doctor, but one day I was sitting in my anthropology class at university, and a student beside me was preparing for her DAT and was looking at these spatial puzzles, which I think they still do in current day, but it's like a spatial perceptual component of the exam. And it just looked like puzzles to me. I said, "What are you doing? Can I take a look?" And I just looked at it and I was like, "Oh, this is very interesting." And oh, this one is A, right? This one is D, right? And she'd go to the answer page and say, "Oh, yeah, actually it is." And I'm like, "Give me this book. This is actually something that I can understand and do pretty well." I think that actually was related to my music. That teaches you a lot about spatial perceptual kind of concepts, which is very important in dentistry. So it was just by chance I got a look at that book, and I saw the deadline to apply was like a few weeks later. So I just started to prepare, and there we were.
That's such a beautiful connection between medicine and music. And your story is proof that it's possible to follow two very different passions if one is willing to put in the time and effort. So, what advice would you give to aspiring musicians who want to pursue a career in healthcare?
Um, well, first off, never give up your music. If you're a musician looking to go into healthcare, I think it's a great match. When you look at a lot of amateur musicians such as myself, a lot of them are there's a lot of doctors that play music. They have an instrument that they play, and so there's something about our brains and how we are wired that allows us to pursue healthcare. I don't know what it is. Part of that was that spatial, perceptual, creative, disciplinary sort of behaviors that are all instilled in us when we were learning music. But there's something else too. There's just it's something that I can't quantify, that a music brain works well in the field of health and vice versa. People in the field of health should take up an art, as part of their hobbies. So I would encourage people to do it because it's very complementary. Maybe back then, I don't know what it is nowadays, but back then maybe in medicine they weren't very supportive in us students like pursuing extracurricular activities like music or sports. They wanted us to commit completely into medicine, except for dentistry. I found that during my university training, all my dental professors and instructors were very encouraging in me keeping up my music as part of balance in life. So yeah, that's whatever it is that you choose to do, you've got to always have some sort of passion on the side. You don't have to choose um, your work as your passion, because working and being passionate with that is very rare that you can find that. So if you don't find that, and work is work, no matter how much you love it, it's still something you have to do. So it's important to have that side passion. And in my case, it's music.
Yeah, that's really inspiring to hear. Yeah, I mean, before we end today, we just wanted to ask if you had any other thoughts about dentistry or music or anything else. Any other comments, concerns, maybe advice you would like to give?
Um, well, being that the target population for this lecture is more aspiring health professionals, I would say just what I said, and that is to make sure that you have something that you live for, something that you're passionate about, and don't give that part up, because um, the field of health is so critical, so important, but at the same time, it's so demanding and taxing, both physically and mentally. So make sure that you have what you enjoy, whether it's um, something in the arts or sports or anything that stimulates your mind in another way. Keep that balance going, because that's what's going to keep you doing this for years to come, and you'll be able to take care of old guys like me.
You're you're really young. I Yeah.
I think I'm twice your age. You can't say that.
You look really young.
This is Youth Advocates for Global Health Association, a nonprofit organization led by students passionate about medicine and striving for global health equity. Thank you so much, Dr. Yu. It's been such a great pleasure to have you speak on our show today. Yeah, and to our audience, we hope you enjoyed today's webinar session. Make sure to register on our website to attend our future events at yagha.org.
Thank you so much, and we'll hopefully we'll keep in contact. Wish you the best of luck with everything going on, and good luck with your piano and periodontist.
Well, thank you, Jonathan. Thank you, Matthew. You guys, I commend you for taking this initiative, which is very important and beneficial to everybody, young and old. So good on you, and wish you guys all the best in the future. Keep in touch.